Dr. Moy, the AMA has been calling for stage 4 restrictions for a while now. Why would this make such a difference at this point?
The thing to understand is that the lockdown that's in place now is not really a lockdown in the sense of previous pandemics and what happened in New Zealand, where they went hard and early. This is a very light lockdown, and probably most critically, people are still going to work, which the Premier admits is actually still a significant source of transfer of the virus. So the level 4 lockdown, most critically, is that the only people that go to work are those for essential services. And we have been calling for this for 2 weeks, and we're imploring the government to do this. Look, being frank, behind the scenes, I think you need to understand that, the authorities in our state and most of the other states and other federal authorities are actually pretty furious and pretty alarmed at what's occurring in Victoria and the fact that they haven't moved to that. There's been this finicking around, frankly, trying to sort of slowly add little bits and pieces, when really what we need is a complete shutdown of this, because this is not only putting at risk Victoria, it's actually putting at risk the rest of the nation. As you can see the temperature going up all across the nation. The thing that's actually happening that's of real concern is that we're building up this large number of people that are not being contact traced in time. And they are going around and they're spreading to other people. So at the moment, this is actually slowly building up. So it's like a balloon that's been building up. And we're hearing these numbers slowly go, okay, so it's 200, then it's 300, then it's 500, then it's 600. And we feel like we're being boiled like a frog in boiling water. Really, it will reach a critical point, and it really is a time to actually bite the bullet. And frankly, the word I've been in contact with some modelers about this who are just saying the same thing, and they say it's now or never. It's time, and no more finicking around. Got to go to level 4.
One of the issues that was raised by Dr. Brett Sutton in his press conference was this idea around what's an essential business and what isn't. We know it can really be a line call a lot of the time, and a lot of these places where there have been outbreaks at workplaces have actually been places that would normally be considered essential, things like an abattoir, healthcare settings. Is it really possible to be making this distinction about what is an essential business and what isn't?
Well, number one, I don't think an abattoir is an essential service. I mean, there are other places in Australia that will be able to provide meat. I mean, that's number one. That's a very interesting one, because that was actually brought up specifically with me a little while ago. That is not an essential service. Certainly places like aged care are, but the thing is had the lockdown actually occurred earlier, it might not have actually got into the aged care in the first place. But look, I agree, there is a bit of subtlety to this, but I don't think we do. But the overall sort of mucking around with this, it's time to move on. Our president has implored the government to go to level 4 at this stage. Otherwise, you reach a critical point, and we are talking about the balloon just slowly increasing in size, and somewhere along the way the balloon burst. So again, the modelers are saying now or never.
I don't mean to labour the point, but it is really important in this discussion about what an essential business is. One example that's been put to me is a mechanic. You wouldn't normally think it's an essential service, but what if they service ambulances and cars that carry essential medical supplies? Does that make them essential or not?
That would be essential, but then that might be different from normal mechanical repairs. It would be a different category. I mean, look, we do have to work that out, but I don't think that is possible to do. But really, at the moment, we're not even close to that at the moment. This is a very, very light lockdown at the moment, and not even close to anything that's occurred in previous ideas about what a true lockdown is, and certainly what occurred in New Zealand, for example. So we can certainly take a lead from New Zealand.
Aged care has been the other big focus this week, just because the situation is so dire for so many in that setting at the moment. There are real and really serious implications of having people in that aged care category, elderly people alone, isolated, possibly sick, not in contact with family or loved ones, and really scared. Does that need to be weighed up against what the medical response needs to be for those and the likelihood of contracting coronavirus?
Yeah, it's a terrible situation. I actually do work in aged care. I'm a doctor that visits aged care facilities, and I totally understand the problem, because unfortunately these areas are like firelighters for the condition, and it spreads through so quickly, and the risk of one person getting it spreading to others is so great. But the flip side is obviously maintaining contact for those individuals, maintaining, particularly if they are actually deteriorating and have the condition. It's a terrible, terrible state of affairs when that happens. And certainly the idea in that situation is to make sure, if at all possible, there can be at least, for example, technology to maintain some contact, and also the ability for phone contact at the very least. It is a very terrible situation. On the matter of the whole aged care side of things, the AMA is really calling for a really rapid audit and risk assessment of all aged care facilities. That really has been laid bare in Victoria, that wasn't done, and what was up to now is not been adequate to make sure that the facilities are ready for things like making sure that they don't have staff going in and out from various organisations and bringing it in, that they are making sure they have enough PPE, they have the protocols, and ideally have the protocols to make sure that there's maximal communication between people in the facility if, for example, it goes to lockdown. So if you have a poor resident who's in lockdown, feels isolated, there's the maximum ability for them to be able to communicate with their family and friends.